Ladies and gentlemen, welcome to yet another episode of the Sunny Shah Show. Today, we have a very special guest with us, a veteran from the healthcare industry who spent almost 3 decades of his life serving India as a nation, transforming the healthcare within India, touching millions of rural lives. He has been pivotal and has pioneered in transforming the diagnostic divisions of healthcare. Ladies and gentlemen, please welcome Mr. 𝗵𝗵𝗵 Rajput, serving this industry for over 3 decades. Can you tell me where it was and where it is now?
So it has been a marvelous journey. I would say we are the most fortunate generation that we have seen all the three transformations. Like we have seen the telegrams of the world, we have seen postcards, we have seen pagers, then we have seen mobile phones, and now we are seeing AI, right? The most of the healthcare innovations have happened during the pandemic. And the technology has helped us. And who would imagine that today your medicines will be delivered in 30 minutes?
True.
Or your home phlebotomy will be done within 45 minutes of ordering. And definitely technology has played a role. Even our government, our regulatory bodies have helped us to formulate this, adopt these technologies. So we should thank our leadership in the government also.
So you think the political scenario in India has actually catalyzed the transformation in a positive way?
Absolutely.
That's nice.
We have seen that during COVID or during pandemic, that the government has been very supportive and the policymakers have been very empathetic towards the needs of the healthcare professionals.
It's very interesting. You briefly touched upon pandemic.
Yeah.
It was very unfortunate times for all of us. But one thing that stood out and that touched almost everybody, it was affected directly or indirectly by the COVID-19, was the fact that our diagnostics industry, especially in India, stood tall. And almost overnight, we saw an evolution in that space. Would you like to cite a few first-hand examples that you would have faced and intercepted during that time?
It was a lifetime experience for all of us. And the entire world was worried how the things will pan out.
True.
And we were not knowing this as a common man. He was not aware that whether I'm infected or there were a lot of fear factors also there. A lot of misconceptions were there. So we had to work on both sides. One side, you need to work on the misconceptions, creating awareness. Second was delivering the service and rapidly ramping up your capabilities to address such a huge need. So I imagine, I can remember, there used to be a time when I used to have 40 or 50,000 inquiries a day for COVID collection, or 80 or 100,000 orders for medicine deliveries. So that kind of surge of volume was there.
And were you ready technologically to address that? Or you guys evolved over a period of time?
So that is the interesting part. That led us for innovation. We were not ready. Let me be honest. We were not ready for that. So we challenged ourselves and we came together as a group. So in a day, I remember with 800 people, we collected 24,000 samples.
Interesting.
So nobody is perfect. We need to all come together and we need to work on the ideas. We need to work on the implementation part, and you need to continuously evolve and take feedback from the ground, because there even a small user on the ground is very important, because the aspect what he will give, nobody can tell you. So that has really made the challenging phase very easy for us. And I think we did it very well.
I think we all coined this term called COVID warriors.
Yeah.
But I think it is important to recognize silent leadership, people like you during those times that quietly performed and executed what was asked to transform an industry overnight to support the sheer population of our country. I think in a way, you were a savior to a lot of Indians, and we can only be thankful for that.
Yeah. We think it was an opportunity given by God to us to serve the people and save so many lives. It was a noble cause.
We talk about the business of healthcare, but you are in a business where you also have patient centricity.
Right.
Obviously, everything that you do still evolves around maintaining a strong patient-first approach. So what strategies have you seen in these large brands that you worked for throughout your career that are helping keeping this balance in place?
The most important thing is your relationship with the customer. So empathy is very important. How your staff is trained, how they communicate with the patients, because they are already in pain, they are suffering, they are anxious most of the time. So they need somebody who can listen to them. So that itself will take care of half of his anxiety. So training is very important. Then how you engage with them, how you give them information. So there the role of your frontline staff is very important, because your phlebotomist or nurse or your frontline reception, they are like a brand ambassadors for you. Then comes your technological or your medical care. So there, of course, doctors are experts in that.
I feel that the healthcare industry in India is on the cusp of large scale disruption. So if you were to look at the insurance industry in India, well, I remember almost a decade ago, people were not that cognizant about the fact of how important insurances are, let alone your term insurance or health insurance. But now that you see that cognizance and you see that sense of responsibility emerging, and that
Right.
has led to a transformation and disruption in the insurance industry.
Absolutely.
I feel we are at a cusp of, obviously pandemic triggered it,
Yep.
and the aftermath of pandemic still persists, where a common man is more health conscious.
Yeah.
How do we ensure that the cost of healthcare or the privatization that's leading this change or the business centricity of our healthcare industry is still balanced in a way where, while it's commoditized, while it's a business,
Yep.
it still has, because it's an empathetic business
Absolutely.
and it has to be led by a right balance and checks and measures. Do you think that's happening, or is India going in the same track for a lot of first world countries where access to healthcare is a privilege and not a right? Where do you think we are?
I think our bed to number of patients as well as number of doctors ratio is still, there is a lot of catching has to be done, particularly in tier 2 or tier 3 and tier 4 locations. But the healthcare is shaping up well in tier 1 and the metros, right? You'll see a lot of single specialty or the mid-size hospitals are coming up and they are doing well, right? And I think this trend will continue for another 8 to 10 years, where a lot of bed capacities will be added in tier 1, 2, and 3 even. So you'll see a lot of capacity addition in this sector. Second is insurance is definitely helping. The adoption rates have gone up. And also the government schemes are also helping here. So Ayushman Bharat, and they have really improved the healthcare delivery, right? Even if you go to district places now, so a lot of people are taking benefits of that. Even bypass and that kind of surgeries or cancer care, I think is being highly subsidized by many of the state governments and also by central government. So that is a really good trend what I am observing. And I think India is still, I think you will say we are getting good service at a reasonable price.
So you think the
Balance is absolutely there.
and for a foreseeable future, India will have the largest population coined as senior citizens that we've ever
Absolutely.
had in our history.
Absolutely.
Do you think our industry, especially healthcare, is geared up to cater to that kind of volumes?
I think that is where a lot of hospital chains are adding capacity.
Okay.
You will see every city, I think there will be few hospitals which are under construction. So I think capacity addition is happening. And also they are going deeper into these. So hub and spoke models are being now put into place even in hospital industry now. So that care as well as the delivery patterns, I think, are getting quite SOP driven. So hub and spoke is getting created, primary care, then secondary care and tertiary. So those models I'm seeing evolving across India.
With the use of technologies like robotics, AI, precision medicine, etc., how do you see these technologies in your industry influencing leadership decision making in the coming times?
Yeah, see, AI is going to help us, right? So AI is our friend or buddy, I would say.
Right.
So they will help us to make better decisions. AI is going to help us because today we are driving certain algorithms which are going to help us to diagnose or have a summary very quickly so that we can make a informed decision driven on the data. So it will make the job of the physician very easy. So what medicines I should give, what is the lifestyle I should ask for the patient.
So do you think this data-driven decision-making practices are going to replace the traditional way of clinical expertise, or are they here to complement each other?
They will definitely complement each other.
Right.
Because you cannot substitute the expertise, right? Because that is the human intelligence. It is based on the years of experience.
True.
You cannot substitute that.
I know it's difficult to quantify, but for the interest of our audience, would you be able to kindly tell us how many people have you touched upon in your life as a leader? Can be a guesstimate.
So I must have hired more than 10,000 people.
10,000 people in
Yeah.
India.
So created a lot of job opportunities, particularly in newer geographies with innovative business models. Because we have created outreach in healthcare. We have gone to tier 2 or tier 3 markets by and large. And it has been a business transformation in an unorganized sector. So Sunny, life has been very happy for me, and I am grateful to God that He has given me opportunity to serve so many people and do a different roles in my career. So I'd like to give back to the society. So I'd like to develop a lot of leaders. I would like to coach or mentor people so that they can benefit from the experience or what ideas I have. Then as a leader in this industry, healthcare, so there are a lot of challenges in our society, non-communicable diseases. So I'd like to definitely create such a system where people get easy access to the information.
Right.
On their lifestyle, on the preventive things. So I would like to contribute on that so that the quality of life improves. The outcomes on non-communicable diseases is better because non-communicable diseases are silent killers. So I want to create awareness as well as create a platform where people are able to access to the information and take positive interventions into their lives, which will make human lives better and we all can live healthy and happy life.
So, ladies and gentlemen, don't go by the modesty of this man. He has played a pivotal role in the formative stage of the Indian healthcare industry. From the time it was unorganized to making it organized, from the time it was unstructured to making it structured, and now leading the change for the digital disruption in this space. That's Mr. Rajput for us. Please follow him on LinkedIn and other mediums. You can find his details in the description below. Please do not forget to subscribe to our channel if you haven't done so that we are able to bring you more such insightful discussions. Until next time, this is me signing off. Thank you so much.